Hey guys, it's Leah Buckles from Prestige Veteran Medical Consulting. I'm a U.S. Army veteran, physician assistant, and former CMP examiner. Today I want to come on and discuss tension headaches as they relate to depression. So we've done a lot of videos on different types of headaches, tons on migraines and different things about them and how they can relate to your service on either a direct or secondary service connection basis. Today's topic will be on tension headaches. They're a little bit different types of headaches, but many veterans and many people suffer from them. So let's just jump right into what are tension headaches. So tension headaches are a type of headache that can be chronic in nature, and they can be described as like band-like. Generally, they're going to be double two-sided. Migraines traditionally are more one-sided types of headaches. Not always, but these are traditionally the way that they're described. The Mayo Clinic describes tension headaches as feeling tight and band-like around the head. They are the most common type of headache, yet they're not well understood. Some of the symptoms can be dull aching head pain, sensation of tightness or pressure across the forehead or the sides of the sides and back of the head, tenderness to the scalp. So that's pretty much it. Like migraines, like I said, migraines are typically going to be more one-sided. There's a lot of associated those migraine prodromes. Also, they can have a lot of vomiting and nausea. Again, there can be overlap with the types of headaches, but most of the time we see that tight band-like or tension type headaches that can be almost muscular in origin at times as well. So that's tension headaches. So how are they service connected? So they can be connected on a direct or primary basis. They can also be connected on a secondary basis. So what do we mean by a direct or primary basis? So if you experience tension type headaches while on active duty, you were diagnosed with them, you developed them at that time, they can be related on a direct basis. Not always. If you only had one tension type headache and then went 50 years without having them again, that may be difficult to show that they were a continuous headache syndrome that you had for many years, right? On a secondary basis, tension type headaches can be related to a number of things. We can see it related to neck pain often, stress related disorders like PTSD, depression, anxiety, bipolar disorder, things like that. And so those are the things that we see them mostly too. So I wanted to come on and discuss. I'm going to give you a couple pieces of literature. I'll give you a piece of literature about these types of headaches that we use in some of our letters, and that may help you when you're discussing it with your treating provider if they'd like to give you maybe you can bring that to them and they can agree or disagree, maybe write something in your notes, or maybe you can look up this article and see if it applies to you and it may help you in some sort of way. Okay. So anxiety and depression and tension type headache, a population-based study published in October of 2016, investigated the prevalence and clinical impact of anxiety and depression among patients with tension type headaches in the general population. There is a bunch of information here on that study, and it concludes that anxiety and depression were more prevalent in participants with tension type headaches than non-headache participants, and that these two conditions were associated with an exacerbation of headache symptoms in individuals with tension type headaches. Generalized anxiety disorder, subthreshold anxiety, and anxiety symptoms and primary headache, published in Psychiatry and Clinical Neurosciences, is another good study to take a look at. Let's see. Those are two good ones that you guys can take a look at. There's several other ones I've gone over in other videos that just discuss headaches in general and stress, but they're more non-specific to the headache type. Okay, those were two tension type ones that we talk about. So what are some things that certain people do to help define these? We have a really great video on migraine logs. Now, migraine logs can be also used for tension headache logs. So you can describe, the frequency, the duration, how they affect you, things like that. That may be helpful, and showing the severity, right? So let's talk about ratings, okay? So these are generally rated the same way as other types of headaches, right? So at the 0% rating, and these are always subject to change. I'm not an accredited claims agent, BSO, or other legal professional, so I'm going to throw that out there. You always want to clarify this with somebody that's assisting you administratively. But for informational purposes, 0%, all the way up to 50%. 0% is, it says less frequent attacks. 10% is characteristic prostrating attacks averaging 1 in 2 months over the last several months. 30% is those prostrating headaches, tension type headaches, very similar to the migraines, on average of once a month over the last several months. And then if you're having them on average of once a month over the past several months or more, and then they're causing severe economic inadaptability, that can be the 50%. We have a really great video on severe economic inadaptability and the 50% level. You should check that out because that's a really hard thing to define and sometimes can get a little bit tricky. But I hope this was helpful to you guys. Please let me know, drop some comments on tension, headaches, and depression. If you guys have any questions, I'd be happy to try to answer them. And again, thanks for watching and have a great day.